Hi everyone, and thank you for attending my presentation. I would like to also thank the organizers for the invitation. My name is Sam Freiberger, and today I will present our work on uncovering socioeconomic gaps in mobility reduction during the COVID-19 pandemic using location data. This is joint work with colleagues at the World Bank, FBK, EPFL, and Oxford. So on March 24, 2020, the Indian government engineered the largest restriction on human mobility in history by imposing a lockdown on its 1.3 billion citizens. This picture shows how the crowd walking along the iconic Marine Drive in Mumbai suddenly evaporated, echoing similar pictures taken all over the world as governments implemented social distancing policy interventions to curb the spread of the COVID-19 pandemic. These measures undoubtedly helped reduce the virus reproduction rate. In India, the growth in the number of cases went from doubling every 3 days before the lockdown to doubling every 6 days by April 6 and doubling every 8 days by April 18. However, the effect of these measures were far from being evenly distributed. In a city such as Mumbai, about 40% of households live in slums. In the Dharavi slum alone, here in this picture, 1 million people live in a 1 square mile area, with 80% of them using communal toilets. So with limited space, tightly packed housing, and shared public amenities, people in such settings cannot properly maintain safe physical distances from one another. The need to quantify the heterogeneity of the impact of social distancing policies is what motivated our research. So in this work, we estimated the impact of social distancing policy interventions across socioeconomic groups in middle-income countries by combining smartphone location data with data from population census. And we found that high-wealth smartphone users reduced their mobility about twice as much as low-wealth users. Now let's get into the details. So to quantify the impact of non-pharmaceutical policy intervention on human mobility, we used privacy-preserving smartphone location data collected between January and July 2020 by Cubic, a location intelligence company. Our dataset contains the time-stamped geolocation of about 3.5 million smartphone users in Mexico, India, Indonesia, and Colombia. This animation illustrates the movements of 3 users located in Mexico City during the month of January. In this talk, I will mainly focus on how we used this data to quantify variations in the time users spend at home as a proxy for mobility. So first, we started by transforming each user's time series of GPS coordinates into a sequence of stop locations where the user was stationary. The map on the left shows the raw GPS locations of our 3 users on January 15. And the one on the right indicates their stop locations retrieved using a state-of-the-art algorithm called InfoStop. Each cross corresponds to a stop location computed using a radius of 200 meters, the size of a cross being proportional to the time spent at that location. We then inferred each user's home location to be her most frequently visited stop location between 11 p.m. and 7 a.m. So having mapped each user to her home location, we could then estimate the change in the time users spend at home resulting from social distancing policies. The Oxford COVID-19 Government Response Tracker, here in orange, is a composite indicator measuring the stringency of 9 policy actions, including school closures, workplace closures, and travel bans. In the 4 countries that we studied, this index peaked between mid-March and mid-April. We found that the average increase in the time users spend at home during the month of April relative to January was equal to 27% in India, 26% in Colombia, 22% in Indonesia, and 20% in Mexico, reflecting the stringency of each country's policy actions. And we also found that although the coverage offered by Cubic data in middle-income countries is low, our estimates of the change in the time users spend at home are highly correlated with the country-level estimates shared by Google, with correlations higher than 97%. So having validated the quality of our country-level estimates, we could then exploit the highest resolution nature of the cubic dataset. So our main objective was to measure the heterogeneity of the reduction in mobility across socioeconomic groups. However, our smartphone location dataset does not contain demographic information on users. So we used as a proxy the demographic characteristics of the neighborhoods where they live. We started with the most recent population census in each country, from which we extracted data that could be used as a proxy for wealth, such as having access to electricity, having a washing machine, the quality of a house floor, having a toilet at home, and so on. Then we constructed a wealth index by taking the principal component of these variables. And finally, we approximated each user's wealth with the wealth index of the average household living in the neighborhood in which the user's home is located. We could then estimate how mobility varied over time, conditioning on wealth. So the purple line here again corresponds to the change in the time spent at home by the average user, taking January as a baseline. We found that users living in the 20% wealthiest neighborhoods, here in red, consistently reduced their mobility more than the average user. The reduction in mobility for the month of April was equal to 29% for India, 30% for Colombia, 25% for Indonesia, and 21% for Mexico. By contrast, users living in the 20% poorest neighborhoods, here in blue, reduced their mobility less than the average user. The reduction in mobility for the month of April was equal to 17% in India, 16% in Colombia, 10% in Indonesia, and 11% in Mexico. So taken together, our estimates indicate that high wealth users reduce their mobility about twice as much as low wealth users. And these results hold if we restrict our estimates to users located in urban areas and by controlling for population density. Since wealthy people are more likely to own a smartphone than the average person, our sample of users is not representative of the population. Yet we still think that this analysis is helpful for epidemiologists and policymakers seeking to determine the impact of policy interventions on various subpopulations. Several factors could explain the large gap in mobility reduction that we observe between high and low wealth users. First, poor people's jobs are less likely to be done from home. Recent estimates show that while 37% of jobs in the US can be done from home, that number drops to 13% in developing countries, the ability to work from home being highly correlated with income. Second, poor people's tolerance for health risk is often higher, especially when they need their daily wage to eat and feed their family. And third, stay-at-home and lockdown policies are temporarily sustainable if vulnerable people receive economic relief. However, about half of workers in developing countries are in the informal sector, making them less likely to receive economic protection from the government to compensate them for staying at home. So rather than mimicking one-size-fits-all policies implemented in high-income countries, developing country governments should instead carefully weight the costs and benefits of social distancing policies, especially on the most vulnerable populations. They should instead consider alternative strategies such as investing in the distribution of masks, testing, tracing, and isolating, rolling out information campaigns to encourage safe behavior, and improving access to clean water and sanitation. That's it. Thank you for listening, and please reach out to me if you have any questions or comments.